Well, it's a weird thing, right? Because in our legal system, somebody gets in a car accident and they, it wasn't their fault. They have the opportunity or the right to sue somebody. But then in order that they get the settlement all the way through, they have to continue to have pain. So every time they go to a doctor, if they say, my pain's a 3 instead of a 7 like it was before, there's always the chance that that would reduce the amount of their settlement, and can they pay their legal fees, and can they pay all these things. So we have a system set up which you need justice. Justice takes time. And yet then that puts people in the position where they're focused all the time on pain, which because pain is only found in your brain, it's like your brain telling you something's wrong. It can do all these weird things to the way you experience pain.
And the financial stress of all of it, because you have people going for such a long time before they would receive their settlement. Their cases all have to be completely closed. You want to know what is the sum total of all of your medical fees and billing before the case would be finished. And so you have a prolonged period of time where you're living in that state of maybe stress or anxiety, not knowing what's going to happen, what's going to be the outcome of your case. And that in addition to having to revisit the experience over and over again. I mean, tying the emotion to the memory and the experience of pain, and having to relive it for more than 6 months, create a opportunity in your body to interpret sensations differently and rewire the way that you interpret the way that you experience the pain. And it's very hard to get away from, and it can cause people to suffer for a lot longer than maybe they would have otherwise had it not been an accident that was associated with a legal and a car accident and a prolonged period of time. I mean, some people are going to have pain for a long time because their accidents are so severe. So I don't mean to minimize that.
Yeah, I mean, pain is such an odd thing because, as I was growing up as the middle child of 7, if you were experiencing pain, it was unlikely that you were going to go to the doctor unless like you were bleeding or the bone was sticking out of your skin. And so therefore, I just didn't think about pain very much. But now as an adult and I get injured, pain seems to me to be so much more acute than it used to be, because now I see if I can't stand upright, I can't do this work, I can't get this thing done, I have all these other problems that stack on. And it's weird to think about pain as being psychological, because you're not minimizing the fact that it is real, but it is so much about the story that's written into your brain about what's actually going on.
Well, and your prioritization. So as in your example, you're describing that pain may limit you from being able to work, which limits your ability to make money. So there's a lot more tied to that improving, just like maybe an athlete that had a scholarship and then got injured. There's a lot more tied to of financial, emotion, stress, an event, all of those things tied together change how your body's going to prioritize that symptom. And so your pain that you might have that would limit you from working, your body would see as much higher, as opposed to if you had a pain that maybe you were trying to hide because you thought it might limit your ability to work. If people knew about that pain, you might experience that differently. Or an athlete who has something coming, an event or a race or something coming up, and they don't think the pain is going to limit them, but maybe it keeps them from being the starter. They might not experience that pain as high. They might not see it as high a priority because they don't want it to be there. It doesn't benefit them in any way for that pain.
So then when somebody comes in to talk with you about, I'm in this pain, doc, I need you to help me with, my back or when I'm running, or how much do you take seriously their pain? Like, that seems like a weird question.
Very seriously. Yeah. And I guess the way we help people to overcome it is to become in control of their body and their movements, so that they can minimize stress on an injured tissue, so that they can be in complete control of when they experience the pain. So if they were having a symptom that was preventing them from sleeping, if we can give them 3 strategies to get rid of the pain and go back to sleep, now it's no longer interfering with their night's sleep and their next day. And so we're trying to help put people in control of their symptoms. But the challenge to that is when they come into the clinic, then we're asking them, does this make your pain better or worse? Because we're having to identify what are the specific movements that are aggravating that symptom. So how is the joint moving? Or multiple joints moving that are causing the pain to happen? And so we never want to focus too much on, once they know and can recognize a symptom, is it getting better or worse? But not necessarily, is it a 5? Is it a 6? Is it a 7? Is it a 2? Like on the pain scale, what is the pain number? So is it improving or not? Is what we try to move to pretty quickly, just because we're not trying to keep that focus on pain. We don't want them to over-focus on it. We just want them to be able to recognize it. So I work with runners, though, and there are plenty of runners. So that's kind of in people that are at risk of it turning into a chronic issue. I work with runners, and many of them just don't feel their pain. And so then I'm much less concerned about, is it getting better? Is it getting worse? What is the number? Because for some people, they have to be able to, it is part of them improving, being able to identify that they're actually experiencing pain before it's a 10, before their leg is buckling and they just can't take another step. So, there's a lot of different experiences. So somebody that's worried that pain is going to limit them from running is a different way you would approach that. You wouldn't keep focusing on the pain, as opposed to somebody who came in and they can't provide any resistance in a certain muscle group because they've strained that muscle to such an extent that it's not functional. Like, they did not feel their pain to be worried about it. They didn't worry about it. They didn't feel it. They didn't know it was there until it completely limited them from doing anything. So those are kind of two different people in the way that they have pain. And so the way we communicate, hopefully, is different in the clinic to each of those individuals.
So earlier in this exercise series, I spoke with Mark Spiewak, who's this running coach. He's a fascinating way to think about how to get runners to perform at the level that they want to, whether it's just like getting out and doing 2 miles versus running a marathon. And he had this phrase called talking to the pain. So when you get to 3/4 through in your race, you now are hitting a point where, in order for you to fully succeed and to embrace and to go the distance, you've got to be able to talk to that pain. But when you're talking about pain, it's different. So
like, different pain.
Are we missing
right?
words in the English language?
Maybe
or
we
what
are.
Is it?
So we would describe pain as, in the clinic, I would try to piece that out, help somebody to piece that out. Is it sharp shooting, aching, burning, numb, tingling, dull? Like, what is that? Is that a pain, or is the muscle really tired?
It's so funny when you say that, because like, I'm laughing when you ask me, is it burning? I'm like, it hurts, right? Like, I don't even want to take the time to think about what kind of pain it is. Because all I can say is, like, my brain is telling me, fix this problem, it hurts.
Well, most recently you told me throbbing, so you have actually been able to label.
Only because you won't
things.
Start unless I tell you.
So, and that's the runner that we talked about that comes in that's complete, like, they can't move a certain limb. They've like completely just run through, not noticed their symptoms. They're the ones that have a hard time saying, is it muscle exertion? Is this physical exertion? Is that the pain like Mark is talking about? Mark is not, I suspect, advocating people to run through a joint pain or nerve pain or injury. And I think it's important to have a coach also to help you be able to identify the difference. And there is always some amount of aches and pains that come along with running. And so it's identifying when those are an injury. Are those something you need to treat, or is it something that's going to get better in a day or two and you just need to keep going?
It seems like that is a really important word for us to figure out, like, because there really is that difference between, I am feeling something that is discomfort because I want to run faster or I want to go further, versus like, I can't sleep or my arm doesn't work or whatever that is. Mm-hmm. It's odd to me that we don't have a word to distinguish those.
I should know it if there is one, but I don't have a clear answer for you on what that word is. But in swimmers, we also have a really, really big problem with this in swimming. And there's actually been articles published about it, because there's just a common expectation that shoulder pain is to be expected and is common and is part of the sport. And I know myself, I didn't address my shoulder injury when I was training until I couldn't physically lift my arms up over my shoulders anymore. And so at the time, I didn't know anything about physical therapy or pain, or all I knew is that I wanted to swim. But in that sport, now they have recommended decision trees for coaches on when to send an athlete to a medical professional. And they go something like, has the pain been there more than 3 to 4 days? Is it limiting you from washing your hair after practice? Is it making you change strokes in the middle of practice? Is the pain lasting for more than 2 hours after you swim? All of those things don't send somebody to a medical provider. There's like a whole nother column where they're like, you can no longer practice at all. And you can't, like the extent of which the shoulder pain is recommended in the literature that somebody go in and see a medical professional is really severe. And it's just such a shame because there's so many things that we could do to help someone, a physical therapist could do to minimize that pain when they first start to experience it, as opposed to when they can't reach up overhead.
Well, I know the reason why, before I met you, like if I had pain, the idea that I was going to have to jump through hoops to be able to get to a doctor or go see this person that would then refer me to this person. Now, inside of the calculation is, am I feeling enough pain that I'm willing to sit on hold, that I'm willing to go look up the numbers, that I'm willing to go do all this like bullshit that I don't want to have to do?
That's what we're trying to cut out with our business. We're trying to make it easier for people. They can access physical therapy without as much of that. And so, yes, we still require referral in the state of Missouri. But as long as someone has a primary care or a physician that they check in with, and maybe an orthopedist, someone they check in with relatively frequently about their musculoskeletal issues, we can do an evaluation and send that evaluation, call and talk to the medical assistant or the MD. Yesterday, got an MD on the phone for one of the patients and talked about what I saw, and they're happy to send the referral. So that's been that whole process is, as we've continued in business, we've seen it to be not nearly the barrier that we expected it to be. So yes, it's terrible to sit on hold, but hopefully you don't have to sit on hold at our clinic.
Thanks for checking out this podcast short. If you like this interview, make sure you hit the like and subscribe button and hit that bell so you always get notified about this podcast. And if you're really interested in conversations like this, you may want to consider joining the Articulate Ventures Network. To find out more, go to network.articulate.ventures.